Chapter 49. Kidney and Bladder Troubles. The human body is a living engine. Like any other engine, it burns fuel, food, and requires a constant supply of oxygen, as well as water and various important chemical substances. Once these various food materials have reached the organs of the body, they are quickly utilized for energy and for repairing damaged tissues. All of this means that there is a constant building up and breaking down of tissue, a process known as metabolism. In this process, a considerable amount of waste material must be removed if the body is to stay healthy. Part of this waste material is given off through the lungs in the form of carbon dioxide, other waste products being eliminated through the urine. These many and various activities are carried out mainly through the circulation of the blood. The bloodstream itself is a very complex fluid, consisting of myriads of cells along with buffer salts, proteins, amino acids, glucose, and other food materials, all of which must be kept in constant motion by the heart. Constantly keeping check on all these living cells and chemicals are two remarkable organs: the kidneys. They alone determine what materials are to be preserved and what must be eliminated from the body. Although they appear rather small organs, between them they contain some 200 kilometers of tubing over 2 million tubules, each about 11/2 inches long. At the top of each little tubule lies the glomerulus, which consists of a little tuft of blood vessels where most of the chemicals and fluids are constantly being filtered out. Most of these filtered fluids and materials are reabsorbed into the bloodstream so that only the unwanted chemicals remain in the urine. This reabsorption takes place in the little tubules, and thus every drop of fluid in the body is checked by the kidneys many times every day. Normally, the body filters about 300 liters of fluid each day, reabsorbing 299 liters and putting them back into the bloodstream again, and leaving about 1 liter of urine to be excreted from the body. This is about the normal amount of urine passed each day. 562 Kidney and Bladder Troubles. As the urine flows down the tiny tubules toward the center of the kidney, it is finally collected in the renal pelvis. From there it finds its way down through the ureters to the bladder, where it remains until it is eliminated from the body. The amount of urine produced depends on how much water we take and also on the climate in which we live. Heavy perspiration carries off large quantities of water so that the urine tends to become more concentrated, a condition that may lead to the formation of kidney stones. Under normal conditions, a person produces more urine during the day while active, and less at night. However, some elderly people have to get up frequently at night, possibly because of mild heart failure. A healthy kidney is usually able to eliminate almost any chemical not needed by the body, provided one takes enough water and other fluids. When people take too little water, the urine becomes concentrated, and this in turn may lead to chronic infections of the kidneys and bladder. We are fortunate in having two kidneys, even though we can get along quite well with only one or even part of one. So if a person has a badly diseased kidney, it can be removed and he can still live fairly well. Congenital disorders. Children are sometimes born with defective kidneys. No one knows just why. Often it is not too serious because the human body is well supplied with kidney tissue, and such patients can carry on for years and not even know anything is wrong. Many unusual kidney conditions can now be corrected by surgery. But before surgery is contemplated on a diseased kidney, one must be sure the other kidney is working normally, for it is impossible to live more than a few hours without some kidney tissue functioning. Polycystic disease of the kidneys is a serious condition which begins before birth. In this disease, some of the tiny tubules fail to join up with the normal drainage system of the kidney. The urine then collects in little pockets or cysts that continue to grow larger and may eventually burst. The first sign of trouble may be the appearance of blood in the urine and pain on the affected side. There may be an elevation of blood pressure. Poor drainage of urine encourages infection, but with modern antibiotic medicines much can be done to keep these infections under control. All such patients should be under good medical care. Nephritis 563. Bright's disease or nephritis. Nephritis or Bright's disease, also known as glomerulonephritis, usually follows some streptococcus infection of the throat, or an attack of scarlet fever. Shortly after the infection begins, the patient may suffer from puffiness in the face and swelling of the feet and ankles. Often there is blood in the urine, and also albumin and casts, consisting of clumps of red and white cells that have come from the damaged kidneys. All of this means that the normal filtering system of the body is no longer able to function properly. This gives rise to the swelling or edema in the tissue. 564 Kidney and bladder troubles. This condition most often begins in childhood or adolescence, and most patients recover completely. But unfortunately 1 child in 10 may develop the chronic type of nephritis, which may drag on for many years with the patient passing large amounts of albumin in the urine. Later the blood pressure rises and uremia may develop. The patient now has to urinate more frequently, so that at night he may pass more urine than in the day. Unfortunately, the damaged kidneys cannot be restored, but even in the late stages of the disease the patient can usually live fairly well, provided he is given the benefit of good medical care. A further complication, which is due to diabetes, Kimmel-Steele-Wilson's disease, is discussed on page 549. Kidney and bladder injuries. Any type of wound, injury, or heavy blow on the abdomen may involve the kidneys and bladder, and may thus seriously damage the filtering system of the body. Such injuries may be due to falls, car accidents, or direct blows over the kidneys. A full bladder may easily be ruptured, resulting in peritonitis. A fractured rib may penetrate the kidney, or sever the ureter through which the urine passes down to the bladder. In any case considerable hemorrhaging may occur, which may be followed by a serious infection. All patients with any of these injuries are best treated in hospital, if at all possible. Large doses of antibiotics are usually needed, and the damaged organs may need to be repaired or removed by surgery. Cancer of the urinary tract. Cancer is rather rare in the kidneys, the more common type being a hypernephroma which may spread to the bones. Heavy X-ray radiation may bring some relief. Cancer is more common in the bladder, but may not be quite so serious. Blood in the urine is one of the first signs, followed by fever and pain. Any blood in the urine that does not clear up in a few days should be thoroughly investigated. But kidneys and bladder should be examined by X-ray for the presence of tumors, and it would be well to have a urologist pass a cystoscope into the bladder for further examination and treatment. There is no successful home remedy for this or any other type of cancer. Stones and strictures. 565. Stones and strictures. A stricture or narrowing due to infection may occur in any part of the urinary system, or the urinary tract may be completely blocked by a stone. This always leads to further infection and inflammation, as well as dribbling and lack normal bladder control. As soon as such trouble is suspected, some antibiotics such as terramycin should be given, the usual dose being 250 mg 4 times a day. Often this be combined with a sulfa drug, such as gantracin, 2 tablets 3 times a day until the infection subsides. It is most important, however, to have the stone or stricture removed to prevent further trouble. Strictures can usually be relieved by dilating the urethra, using metal sounds or similar instruments, a procedure that is uncomfortable but often beneficial, particularly in older women. Kidney stones. Various forms and sizes of stones may occur in any part of the urinary tract. They are most frequently found in the kidneys, and may cause considerable pain as they attempt to pass down the muscular tube or ureter on their way to the bladder. Although we still do not know what causes kidney stones, they do seem to occur more frequently when the urine is highly concentrated from heavy sweating, or when a person is not taking sufficient fluids. Kidney stones are 3 times as common in males as in females, and they also come on more frequently in middle life. Kidney and bladder stones are formed from the usual chemicals found in the urine, such as uric acid, phosphate, calcium, oxalic acid, and many more. Too little vitamin A or too much vitamin D, because of overactivity of the parathyroid glands, may also produce kidney stones. Patients with kidney stones should avoid taking too much milk because of its high calcium content. Patients with gout are likely to develop uric acid stones. Small stones the size of gravel may sometimes pass down the ureter, causing obstruction and severe pain. This pain is first felt in the patient's side and then seems to radiate down into the groin and thigh. The patient may also suffer from nausea, vomiting, sweating, chills, and shock, and the urine may be tinged with blood. Very large stones may remain in the kidneys for years and never cause any trouble. Smaller stones should be removed if they are too large to pass normally. To be sure a stone has passed, strain all the urine through fine cloth for several days and watch carefully for the presence of a gravel-sized stone. 566 Kidney and bladder troubles. Hydronephrosis. This is a condition in which the stone fails to pass and is not removed, and consequently the kidney that is affected becomes very large because of the urine that is being constantly produced and cannot drain away. Unless this condition is relieved, that kidney may soon be destroyed. Hydronephrosis may also develop from kinking of the ureter, or pressure from some other condition in the abdomen or pelvis. Some pain-relieving medicine must be given as soon as possible. This may be all that is necessary to relieve the severe muscular spasm in the ureter and allow the stone to pass normally. But in all such cases it is wise to see a urologist, or at least to have an intravenous pyelogram X-ray taken to determine if the stone has actually passed. Prostate enlargement 567. Kidney infection. Pyelonephritis, or kidney infection, may arise from a stricture, stone, or other obstruction, such as a rapidly enlarging uterus during the later stages of pregnancy. Usually the patient complains of chills and fever, followed by pain and tenderness in the side over the kidney. There may be pus in the urine, along with albumin and bacteria. Women are more likely to develop this condition as a complication of pregnancy. Pyelonephritis may occur in childhood, particularly in young girls. It is most important to find the true cause of the trouble, so do not begin treatment until all necessary tests have been done, including a culture of the urine. Patients with serious kidney infections should remain in bed until the acute symptoms have subsided. They should be given antibiotics, as suggested in the appendix. Hot sitz baths, as described in the appendix, are also beneficial in this condition. Be sure the patient takes plenty of fluids, for this helps to wash out the germs and prevents the urine from becoming too concentrated and forming stones. Prostate gland. During the later years of life, many men suffer from enlargement of the prostate gland. This interferes with the normal flow of urine from the bladder, so that a low-grade infection may develop and spread up the ureters to the kidneys. The patient may complain of chills, fever, pain in the back and the side, as well as some discomfort and slowness in urinating. He may also suffer from high blood pressure, headaches, fatigue, and anemia. As soon as the infection is brought under control, the patient should have an operation for the removal of the enlarged prostate gland. Transurethral resection is the most frequently recommended prostate operation today. Cancer of the prostate can often be kept under control by the use of very large doses of female hormone. Tuberculosis of the kidney. Patients with tuberculosis of the lungs and other parts of the body may sometimes develop small tuberculosis abscesses in the kidney. Later these tend to break down, leaving ragged cavities, until eventually the whole kidney is destroyed. Infection may also spread down. F-37. 568 Kidney and bladder troubles. The ureter to the bladder, causing severe urinary burning and irritation. The patient feels tired and may lose weight. The diagnosis is most often made by urine culture and animal inoculations. Medical treatment during the early stages of kidney tuberculosis is similar to that outlined for tuberculosis of the lungs, see page 303. Bladder infections. Bladder infections or cystitis may arise from infections in other areas, such as the kidneys, prostate, or urethra. Continual draining of pus and germs from an infected kidney as in pyelonephritis may injure the epithelial lining of the bladder. Trouble may also arise from the presence of a stone in either bladder or kidney. An enlarged prostate or some stricture or narrowing of the urethra may eventually wear down the resistance of the bladder wall, resulting in cystitis. Childbirth injuries and major surgical procedures within the pelvis may also lower the resistance of the bladder wall and predispose to the development of cystitis. Uncontrolled diabetes is sometimes a factor. There is also the problem of new bridges who sometimes suffer from so-called honeymoon cystitis. The bladder wall may become bladder infections 569. Swollen and ulcerated so that the bladder cannot hold the normal amount of urine. Germs may then find their way into the bladder and bring about chemical changes in the urine, and thus calcium or lime may be deposited in the wall of the bladder, increasing the patient's discomfort. In most bladder infections, the patient complains of frequency and burning on urination, as well as an almost continual urge to void. There may also be a feeling of pain in the pelvis and lower abdomen. Blood may be noted at the end of urination. The patient may complain of chills and fever, perhaps due to bacteria finding their way into the bloodstream. The urine should be examined frequently for infection and a special type of intravenous pyelogram X-ray made to rule out further trouble. Treatment: in most cases of acute cystitis, some triple sulfa drugs such as gantracin or thiosulfile should be given 3 or 4 times daily for 7 to 10 days. In more severe cases, penicillin and other antibiotics may be needed, especially when the bladder wall itself is badly infected. The patient should drink large amounts of fluids, 8 to 10 full glasses of water or fruit juices every day. Urinary irritation can often be relieved by the use of azogantracin, pyridium, mondalamine, and similar medications, 3 or 4 tablets a day of any one of these being the usual dose. The urine may change color because of the medicine. This is not important. More resistant infections will often respond to furidantin, the average dose being 100 mg 4 times a day. Because urinary infections arise from various causes, such as kidney abscess or injury to the pelvis, a thorough physical examination should be done. Home remedies are never advisable in serious urinary problems. If the prostate is enlarged, it may have to be either removed, or the normal urinary channel reamed out by a transurethral prostatectomy so that the urine may drain freely from the bladder. Small stones can sometimes be removed through the urethra, but larger stones may require more extensive surgery. Controlling the urine. Urethritis, or inflammation of the channel leading from the bladder, may follow some specific infection, such as gonorrhea or a streptococcus infection. All the pelvic organs may be involved. The 570 kidney and bladder troubles. Patient should remain in bed, taking hot sitz baths 2 or 3 times a day. Shortwave diathermy is often helpful. Antibiotic therapy is advisable in all such cases. A combination of penicillin and streptomycin each day may be helpful. Urinary incontinence. Loss of bladder control may arise from various causes, including strokes, spinal injuries, pelvic conditions, and chronic infections. The patient may lose control of the bladder and perhaps have no sensation in the pelvis, so that he cannot control the urine. The moment the bladder is filled, it automatically empties. The only solution for this is to insert an indwelling catheter. The patient should be given plenty of water, and the urine should be kept alkaline by means of ammonium chloride, 1 or 2 tablets 4 times a day. Such diseases as syphilis, diabetes, pernicious anemia should be promptly treated, and the general principles of health followed as in all chronic illnesses. Uremia. Uremia is a toxic condition associated with kidney failure. Waste materials pile up in the body because they are not normally excreted in the urine. Uremia may arise from many different conditions, such as nephritis, pyelonephritis, polycystic kidney, bladder obstruction, shock, burns, crushing injuries, poisoning, and failure of the heart. The patient with uremia may complain of headache, nausea, vomiting, difficult breathing, muscular twitchings, dryness of the skin, and bad breath. In the later stages there may be marked restlessness, stupor, and even coma. The blood urea nitrogen test, BUN, may show marked elevation, up to 200 mg%, the normal being from 8 to 20 mg%. The patient may feel weak because of anemia, caused by urinary poisons depressing the bone marrow. When the level of urea is high, there may be intense itching of the skin over most of the body. Most uremia patients manage to survive, and a few may actually recover provided the condition is not complicated by glomerulonephritis or tachypnea of pregnancy. Patients with chronic uremia may continue for years in reasonably good health if the blood pressure remains normal. But when large amounts of albumin are lost in the urine, or when there is a severe obstruction to the urinary tract, the outlook is not too good. Should some other condition arise, such as pericarditis or heart failure, the patient may not survive in spite of all that is done to help him. Uremia treatment 571. Treatment: remove the cause such as an obstruction, if at all possible. Except in complete kidney failure, the patient should be given large quantities of fluid so that the urinary output is maintained at a high level, 2,500 cubic centimeters or more per day. Great care must be taken not to give too much fluid when patients are able to pass only a small quantity of urine each day. All patients suffering from uremia should be under the care of a qualified physician, especially if acidosis is present. Muscle twitching and jerking may be relieved by meprobamate, 400 mg by mouth 3 times a day. The diet should be low in protein, and the patient should refrain from vigorous physical activity until he feels better. Anemia patients should be given injections of vitamin B12, 1000 micrograms intramuscularly each week to raise the hemoglobin level of the blood. Severe itching may be relieved by hydrocortisone ointment.